Meetings held remotely will require roll call votes for all action items. To streamline, we'll be combining the action items into one combined motion, so only one roll call vote will potentially be needed during the meeting. Will the secretary please call the roll?
Director Deere is absent. Director Harrington?
Present.
Director Munar?
Here.
Director Story? Chair Ryder?
Here. Debbie,
And-
what other board members do we have?
I was just about to announce that the other directors also present. Director Curry?
Present.
Director Kim? Director Kim? May have stepped away. Director Ketting?
Present.
You have a quorum. And Director Story does, he anticipated being late, but he will be attending.
Okay. Thank you, Debbie. Debbie, do we have any public testimony?
We did not receive any.
All right. First up on the agenda is going to be the May 19th Finance Committee meeting minutes. These were approved by the board at the May meeting, but are being presented for the committee's review and discussion if necessary. Are there any corrections that need to be made to the minutes? Are there any corrections or changes that need to be made to the minutes? Any corrections or changes? Hearing none, we will combine, or we will hold the approval of the Finance Committee meeting minutes of May 19th for the combined motion. I believe we're now going to receive a report from Lawrence Reed, interim CAO of Operations and Development, for our procurement items 1 through 10. And then Charles Jones, our Chief Procurement Officer, is going to be presenting 11 through 18.
Thank you, Mr. Chairman and Directors. Lawrence Reed, Interim Chief Operating Officer and Chief Administrative Officer for Cook County Health, presenting these 10 contracts. The first is for Hologic. This is for laboratory testing of interest, improving the time that we turn around COVID tests. We will go from 8 hours down to 3 hours for our COVID testing. We're also expanding testing for cervical cancer screening as well. So in short, better quality, faster turnaround time, and expanded services for our laboratories and our potential COVID patients. This next contract is for window washing services. This is a request for extension of time, and we will substitute some sites. We'll add Belmont, Cragen, and Blue Island, removing Woodlawn and the Near Health Center. And this will let us clean our windows in the professional building and all these sites. The next contract is for Cintas. This is for supplies, mats, uniforms, cleaning, and so forth. We're going to expand our cleaning into Harrison Square and add uniforms for employees. That was a CBA requirement. The folks at the ERIT group help us put together, and they were able to eliminate a price increase and allow us to expand our scope and coverage with this as well. And on the next one, ERIT group also helped us with this. These are our Pyxis machines. This is the standard for delivering prescriptions and drugs on the units, essentially a vending machine or a robot. Our prior equipment was 12 years old, and we're going to enter into this 84-month lease. It will upgrade our software, all of the equipment, and extend our service level. We'll be able to continue using this, pretty much the standard in the industry for these kinds of robots and equipment. The next item is our picture and archival system for radiological and other studies. This allows us to keep track of our studies and images from radiology, partner them into our medical record system, and keep our radiology programs going and intact. The next one, and we'll call this the next three, actually. These three backstop our vacancies and allow for growth and expansion of our physical therapy and operations within occupational medicine and speech therapy. We currently have 13 vacancies that would cover those, but then assure that we'll be able to move forward and expand as we grow our pediatrics, orthopedics, the burn program, and work at Provident as well. So these next three are taken together. These are common and popular vendors in the agency space, including Cross Country, RCM, and Encore. The next one is for syringes. These are to inject contrast media that are used in CT and MRI studies in radiology. It allows the tech to inject the contrast media in the right amount and at the right time so that we can do our high sensitive radiological studies for MR and CT. And the final one is for the acquisition of disposable infusion pumps. These are often used in a home care setting and allow infusion of medicines without the need to recover the permanent infusion device. These are disposables, and this is more or less the standard for these two. It's a sole source, with this vendor being the only authorized distributor of such disposable infusion pumps. Thank you for your time and consideration of these requests. Any questions?
Any questions for Lawrence? All right.
Thank you, Mr.
Hearing none, Charles, you want to take the batter's box?
Yes, sir, will do. Good morning, Charles Jones, Chief Procurement Officer, Cook County Health. A little housekeeping too. In addition to the 10 contracts that was presented by Mr. Reed, there's 18 total. All 18 required responsive letters from the Office of Contract Compliance. We have 7 back and 11 outstanding. Okay. Request number 11 here, we ask you to extend the contract with Alivio Medical Center for patients, facilitators, and consultants. It's a time-only extension for 12 months, so the vendor can continue the provisions of consulting and staffing services to Stroger to improve its cultural competency. They'll continue to provide patient community facilitators with bilingual personnel to work with the patients and the staff seeking services at Stroger's obstetrics department on a 24/7 basis for inpatient and also follow-up and home visits. We're asking to amend and increase the contract with Cross Country Healthcare that also provides us a variety of temporary staffings, but in this case, only additional staffing for cardiology, $149,000 for positions for the cardio-cath lab technicians, cardio-cath sonographers, and other staffing needs here at Stroger Hospital. We will be posting an RFP in the coming months for all of our allied staffing going forward, starting in FY23. Next request, Debbie. Extend and increase the contract with New Care Symphony Services for short-term and long-term care, $1.68 million FY22 impact, $2.25 million over the next 12 months. Vendor will continue to providing short-term and long-term care services for patients being discharged from our facilities. Patients cannot be discharged home, and at the time of discharge, lack resources for insurance coverage necessary to secure services directly. Fourth quarter of FY22, we'll be posting an RFP as well. Extend and increase health management services for sleep disorder, durable medical equipment and services, $525,000 FY22 impact, $700,000 for the next 12 months. Vendor will continue to provide services and equipment for patients with sleep apnea and other sleep disorders. Provide patients with durable medical equipment such as BiPAPs and CPAPs. Provide patients training on how to use and maintain that equipment. As well, we're in the third quarter of FY22, so we'll be posting an RFP very soon. $700,000 for a 12-month extension. New contract with Kaizen Health for non-emergency medical transportations. Switching vendors from our current incumbent to Kaizen, $1.5 million for FY22, $11.4 million over the next 36 months period. Provide non-emergency medical transportation services on behalf of the entire health system to both the funded and unfunded patients in direct collaborations and coordination with our transportation unit. Provide appropriate vehicles, train the drivers, have software to track and schedule rides, management support service, and attendance in order to provide the non-emergency medical services on a 24/7 basis. This contract has 2 one-year renewal options. A new contract with BCG Management Consultants for healthcare evaluation and strategic advisory services on behalf of strategy, corporate compliance and privacy, and general counsel, $150,000 FY22 impact, $900,000 over the next 36 months period. This will provide the provision of comprehensive health care evaluation services. The deliverables include the development of policy and procedures related to fair market valuations of the physician's contracts and other value-based arrangements, training, strategic advisory services, formal evaluations concerning business enterprise, physicians' compensations, on-call agreement, medical directorship, and management, real estate property, space sharing, lease agreements, and medical equipment in addition to our annual audits. Utilization of this service will help reduce the costs and to support continued compliance with applicable fraud and abuse laws. A contract with LeMaitre for supplies of patches, biological, vascular supplies, $83,000 FY22 impact, $600,000 over the next 36 months. Then it will provide patches and vascular biologics for treatment of peripheral vascular disease. They develop and manufacture the disposables and implantable vascular device that address the needs of vascular surgeons to improve procedure efficacy and minimize patient recovery time. Also, since it's disposables, it does not require sterilization. Applied Medical distribution is for surgical warmers, graspers, retractors, and gel port, $55,000 FY22 impact, $400,000 over the next 36 months. Provide the gel port systems that allow surgeons to rapidly alter between a hand access, straight laparoscopic, and open surgical technique to optimize procedural efficacy and clinical outcome. Contract has 2 one-year renewal options as well. That's it for the regular contracts. Any questions for 11 through 18?
Any questions for Charles? Any questions? All right. Charles, it looks like we're moving to the MWBE metrics.
Yes,
We'll
sir.
hold those contract and procurement items for the combined motion.
Okay.
Go ahead.
So the second column from here to right now, we're looking at contracts for $150,000 and over for December through April year to date. So for April, we have, Debbie, can you scroll over a little bit? The last 2 columns to the right. Yeah, thank you. 28 contracts came before you in April. Of those 28, 10 had contract-specific goals with MWBEs for $6.4 million. Unfortunately, we didn't have any vendors as a prime. We had, of those 10, 3 contracts for $839,000 had subcontract participation and 13%. Very high month for waivers. We had 7 waivers for $700,000 and 11%. but it falls into a specific category. So we had 8 grant contracts with community-based organizations for COVID-19 education and distribution as part of the distribution of COVID materials as part of the IDPH Mass Fax grant. 7 of those 8 vendors did not have participation, and on average, it was about $100,000 per contract. So therefore, a little higher, much unusual than usual for waivers, and also a little down with participation. But looking at the far right column and the year-to-date numbers, 40 contracts, $265 million, 3 primes, $4.9 million, 24 subprimes for $56.6 million, 27 vendors, prime and subprimes for a little bit over $61 million, and 23% for a year-to-date with the numbers. Next page, Debbie. So here's the bar chart with the 36 month for April, which brings down the year-to-date a little bit to 23%, but we're still trending pretty good here. Looking forward to moving back north on the numbers in the coming months. Any questions?
Any questions for Charles on those? All right, Charles, contracts under the authority of the CEO.
Yes, for the last quarter, March, April, May, we had 31 contracts underneath the CPO and CEO's authority, which is less than $150,000. A few metrics on that. Well, all 31 were responsive for MWBE participation. Around 9 of those contracts were GPO vendors. 8 of them was capital equipment purchase, and 11 were grant-related contracts. Looking a little bit at some of the higher dollar ones, the first one, and these are in alphabetical order, for Alpha Building Materials, we did some environmental cleaning for Georgia Hospital, $148,000. A grant with the American Lung Association for advanced tobacco prevention, $141.5 there. A little bit further down the list with Gantt.com Inc. We did COVID-19 vaccine software, $149,000 there. The third entry for Hendrickson and Companies, GPO agreement for capital equipment. We bought the lockers for the mail order pharmacy that relocated from Oak Forest to Soldier, $32,000 there. Second page, Debbie. Thank you. Lynn and Patel was legal services for certificate need for Medicare, Medicaid audits and appeal projects on behalf of General Counsel, $149,000. And then last, Tri-State Dental Supplies, a GPO for pharmaceutical dental supplies, $147,000. And then lastly, WestCare grant-related contract for comprehensive opioid stimulus and substance abuse, $149,000. Any questions on the district board contracts under $150,000?
Any questions? Hearing none. Emergency purchases, Charles.
Yes, sir. We had 2 emergency purchases for the month of May. This first one was issued, notification was issued on May 11th, the Dialysis Center of Chicago for a 12-month contract, $1 million to, on behalf of Providence Department of Nephrology to provide inpatient hemodialysis services, again at Providence. This is in support of the ICU reopening at Providence. $1 million for a 12-month period. And then on May 31st, we had independent contractors, independent consultants that was helping out in ACHN for COVID testing and vaccine. These were amendments to the contracts for the 13 independent consultants. All contracts value was less than $150,000. And again, the individuals continue to administer COVID testing and or vaccines at our sites. dollar value range from the low end of 15,000 to on the high end of 25,500 as we go to the end of this current month with utilizing these independent consultants, I'm sorry. Any questions on the 2 emergency purchase from May?
Any questions? Any questions? All right.
Okay. Thank you very much. That ends my reports.
All right, great. Thanks, Charles.
You're welcome.
Now we're moving to the Chief Financial Officer. Pam, are you there?
I am here. Thank you. Chair Ryder. Good morning, directors. Pam Casera, Chief Financial Officer. First up, we have our receive and file grants. Nothing of unusual to note there. 4.3 million. Several are from Illinois Department of Human Services, Department of Public Health, and National Association of County and City Health Officials. All of these, three of the four are sponsored by the Department of Public Health. And if there are any questions, I believe there may be some folks on the line that can address those. Hearing none. We can move on to the financials.
All right.
Yes.
You have good stuff for us?
Good stuff.
All right.
As you can
cool.
see from our executive summary, a statement of financial condition for the 5 months ended April 30. On a accrual basis, our financials came in at 28.7 positive variance to budget. Couple key drivers there. On the revenue side, we received a 15 million non-county care MCO directed payment catch up. And county care also received 12 million in state corrections to capitation. Then on the expense side, we continue to have negative variances in budget in purchase services expense that is being partially offset by the surplus in salaries and wages due to the positions not yet hired. County care claims expenses greater than budget due to the higher than budgeted membership, and county care's financial performance continues to be strong due to that membership remaining over 430,000, which is greater than the 390 we budgeted due to the pause on redetermination. Next slide, Debbie. So here you can see, just looking down through the variances, the big ones I just spoke to, but drawing your attention to the total revenue line, 11.2 million over budget, the total expense line, 17.5 million under budget. That brings us to our 28.7 million positive variance to budget. Next slide, Debbie. So volumes, as we've discussed the past few months, inpatient has basically been running at budget, but outpatient continues to lag behind. However, almost all areas are better than prior year, and we're sort of kind of stuck between better than last year, but not as good as 2020. But the volumes do continue to trend up. And if you go to the next slide, you can see that trend in these graphs as you compare sort of the year-to-date actual projected to the back to the 2019 mark. You can see that in some areas we're there, and in some areas we're still lagging behind. Next slide, Debbie. Moving on to revenue cycle, our payer mix, nothing significant to note here, continues to run between the 60-65% Medicaid and uncompensated care. Next slide. And staying with revenue cycle, all their indicators in the green with the exception of cash, which took a slight dip in the month of April, but is still well over 100% year to date. Next slide, Debbie. Denials also continue in the yellow in terms of total dollars. However, they did take a big dip in April due to reclassifying a transaction category, which was non-covered service, usually in the industry is treated as a contractual adjustment, not a denial, and we made that change. On the right there, the net final denials are in the green and continue to run less than the industry target of 2% of cash collections. Moving on to our charitable and public program expenditures, we are trending back to budgeted levels of around the 452 million mark. Next slide. And our savings initiatives, both on the revenue cycle side and on the vendor renegotiation side are on track at 5/12 of the goal. Next slide. And then county care, as I mentioned, positive, very positive financial performance, 10.6 million. Their budget was actually slightly higher at 14.2. And I'll draw your attention to that line immediately above. The total expense line is running more than budget again, because the membership is running greater than budget as well. And then the graph down at the bottom, you can see we budgeted for the membership to decline over the course of the year, assuming redetermination would start, which it has not due to the extension of the pandemic. And the red bars should continue at that higher level pretty much through the most of it, almost the end of the year. And then more care, last slide. Not much to report here. Their membership is lower than budget. Their operating loss is lower than budget, and we are wrapping that one up and we'll be exiting at the end of the year. Any questions?
Any questions for Pam?
Great. Thank you.
Great. Let's see here. I think that brings us to the combined motion, right, Debbie?
That's correct.
Oh my gosh, we started this meeting, what, 5 minutes late?
You are correct.
I think this might be a record. All right. I would now be asking for a combined motion to accept item 3A, the May 19th, 2022 Finance Committee meeting minutes. Approve item 4A, contracts and procurement items containing request numbers 1 through 18, subject to completion of review by contract compliance, and receive and file grant award related items. Is there a motion?
So moved.
Motion
Second.
made and properly seconded. Any discussion on the motion? Hearing no discussion on the motion, will the secretary please call the roll?
Roll call on the combined motion, aye or nay. Director Deere is absent. Director Harrington,
Aye.
Director Munar,
Aye.
Director Story is absent, and Chair Ryder.
Aye.
You have 3 yeas and 2 absent.
That's great. Well, the motion passes, and that's all we have. So I just want to thank everybody for attending. Our next meeting is scheduled for Thursday, July 21st at 9:30 a.m. Thank you all for being part of the quickest finance committee meeting that we've had in my tenure here at Cook County Health. With the agenda exhausted, we're adjourned. Thank you.